Jyotsna Bhatt is going to talk about mental health of providers as well as patients, both of which are equally important. I have her bio over there, but Jyotsna, please come. And I want to give as much time as I can for her to speak, again, rather than for me to speak.
Good morning, everyone, and thank you. It was a chilly spring evening a few months ago in northern New Jersey. A young girl, Hannah, walked slowly but purposely up to the George Washington Bridge, which connects New Jersey and New York over the Hudson River. Hannah had taken a train from her home in Long Island and then a cab to the New Jersey side. She was distraught of a number of challenges in her life and was planning to jump off the bridge and end her life. She'd been suffering from lifelong neurological issues. Sorry, I didn't go back. She'd been suffering from lifelong neurological issues, had a history of childhood trauma, and severe depressive episodes that often culminated in suicidal attempts. She had been passed along in the psychiatric units in the hospitals as a frequent flyer. Doctors didn't know what to do with her. Her studies were suffering, and she was afraid she wasn't going to go to college. She had tried counseling. She had tried spiritual get-togethers called satsangs, and she had tried devotional singing. But nothing seemed to stick. So there Hannah stood, staring down at the Hudson River, far below, determined to end her life. I share Hannah's story with you, to remind all of us that mental illness is real. It affects millions worldwide, and that people of faith, even Sai Baba devotees, are not immune, just as we are not immune to broken bones, heart disease, and cancer. Around 450 million worldwide suffer from mental disorders, placing this among the leading cause of ill health and disability worldwide. In the United States itself, about 18.5% or 43 million will experience a mental health illness in a given year. In youth, age 13 to 18, this is 21.4%, and in children, it's estimated to be 13%. PLOS Journal of Medicine in 2013 did a prevalence study of depression across the world, and they found that depression is the second leading cause of disability, with slightly more than 4% in the world diagnosed with it. They also found higher rates, if you can see the rates in red, in North Africa, parts of Asia, and the Middle East, with rates in North America between 4 and 4.5%. Another study states that by 2020, depression will be expected to rank second, only behind ischemic heart disease, as a global health burden. So, mental illness is not a problem just of the wealthy, of the West, of women, or of the worldly. Mental illness is a human problem. So why is this the golden age of mental health? Because for the first time, more than any other time in our history, there's a growing consensus among medical professionals, policymakers, and societies about the importance of mental illness and the treatment. Medical research is recognizing and validating the connection between the mind and body and the need to study this. There are medical schools dedicated to this across the globe, particularly in Cambridge in the UK, as well as in the United States, Harvard, Columbia, UCLA, and University of Pittsburgh, all dedicating departments to study the mind-body connection. And then we have the Obamacare initiative, which expanded on Mental Health Parity and Addictions Equity Act in our own country here in the United States to ensure that insurance plans would cover more of these treatments. I'm seeing this in my own practice. People are able to access care by the millions. In the wider culture, there is a decreasing stigma about depression and mental illness as more and more people are coming out and sharing their stories. It is also the golden age because, most importantly, this is the spiritual awakening. There is a spiritual awakening of the human consciousness in the world. More and more people are turning to yoga, people are looking at alternative therapies, people are meditating. Everyone is searching for a tool that they've never had before to access the spirit and the source of the infinite within. And finally, it is the golden age because we've been given the golden opportunity by Swami to work together to alleviate mental illness and suffering. Sai Baba says, the mind alone is either the cause for either bondage or liberation. The body and the mind are so closely interrelated that physical health is a prerequisite for mental health, and mental health ensures physical health. So, despite all these progress we have made, there is insufficient education and advocacy for those seeking help. Mental illnesses such as depression, anxiety, adjustment disorders, bipolar disorder, schizophrenia, sometimes go undiagnosed, untreated. Oftentimes, doctors, none of you in this room, of course, and simply just put their patients on medications, rather than refer them to mental health and integrative teams so they can receive a combinational approach. Too often, mental health issues are ignored, brushed aside as a lack of faith in God. While we know faith is the foundation of everything, but if someone had a heart attack or broken bones, you wouldn't tell them just to meditate on this. You would say, chant Gayatris on the way to the hospital. But sometimes when we have depression or anxiety, there's always a slippery slope on what to say. And while this is important, meditation and prayer, and as we've been hearing in the earlier presentations, there's so much resources to gather from that. We still need to validate for some people that they need real professional help. Even those of us with sound minds struggle to keep our focus during meditation, during devotional singing. Now add the din of anxiety and depression and how challenging that could be. For a young parent who may have a child with autism who cannot sit still in a devotional singing session, or the young adult who's dealing with her parent who has bipolar disorder and refuses to get help, and she's the sole provider. So, besides all these, we talked about the lessening stigma in the general population, there is still a stigma in the South Asian community. I've had so many adults and young adults come to me to say, I would come to therapy, but what would people think? I should be able to handle this. I should be stronger than this. And while that is still true, we want to make sure that we really reach out to some of these folks and be of support. There's a young adult who recently told me, I've been depressed for so long, I don't have faith anymore in God. I can't hear his voice. And I was trying to reminded her of how God sent the boats to the drowning man. And just like that, how people have been trying to connect with her and get her to therapy and help her get better. So I stay connected with her because I hope to one day that she will get some help. That leads us to how can we be better advocates? Well, we can try awareness, unity, and mobilization. OM. So awareness, it is important that all of us as medical professionals check our own biases and deepen our understanding. Most of us are South Asian, and we want to be aware of the stigma in the community and our own thoughts on this. We want to really advocate for mental health in our practices, in our own communities and families. We want to have unity. It's important that we work together as an integrative team, side by side, medical professionals and mental health professionals, as well as other health professionals with us. We have a real opportunity here, as we've heard earlier. And mobilization. I'm very proud to say that Sai medical professionals are doing an amazing job already with this advocacy. Psychologists are now working in mental health fairs, in the Sai Baba mental health fairs. They're staffing retreats, as we did in the Poconos this year, and they're speaking at medical conferences. But we can do more. We can continue the work on workshops. We can have parenting discussions. I did a workshop on empathy and mindfulness and mental awareness in the last few retreats. We can do more of this. Disaster relief is another large one that had some opportunity to be a part of, and that is another area of need for mental health professionals. Reminding our fellow colleagues to refer to therapists and mental health professionals in a medical fair. A cardiologist, if you have a patient that has blood pressure issues, you can use psych as a resource. Same with GI docs, with your patients with acid reflux, IBS. And let's do more screenings for depression, anxiety, domestic violence abuse. All of these need our attention. I would like to take us back to Hannah's story. As she stood staring over the ledge, something caused her to come off the ledge. Some would call it luck. You and I would call it the grace of God. She pulled out her phone and she called a friend, a Cy Young adult who she'd been in contact with, who had also been connecting with other professionals, medical professionals, mental health professionals. And they were all getting in touch with her to remind her that she's of value and loved. And they were also trying to use their resources to help her get referrals and higher quality care. That day, she came off the ledge. She was able to get on better medications and care. Her story has a happy ending, but for her, the battle continues. But she's alive and carrying on with a newfound faith and optimism for her future, thanks to the grace of God, who brought her friends, who brought her professionals, who stayed in touch with her and stayed connected with her to help her through this journey. This is a story of Ideal Sai Healthcare from a mental health perspective. As I wrap up, I'd like to read a short note we received from Hannah just a few weeks ago. Sairam, by Swami's grace, I'm doing great. Everything has been going well, and I'm better able to cope. I'm leaving for college tomorrow, and I'm very excited. My school offers free psychological services, so I can continue talk therapy there. Thank you and everyone else involved for being a part of my journey to recovery. I couldn't have achieved my dreams of college without your thoughts, love, and prayers. Sincerely, Hannah. I would like to end by offering my deepest gratitude to Bhagavan Sri Satya Sai Baba, who not only inspired me to become a psychologist, but encourages me and guides me every day. Thank you for making me a small part of your mission to serve humanity.